So here's our standard hospital bed in either an intensive care unit or a floor bed. We have all sorts of options here for the bed. We also have bed alarm system right up top here, as well as a height indicator as to the angle of elevation for the patient's head. Some occasionally you'll see one where a patient has to have their head up about 30 degrees. So this gives you a good indication as you bring the head of the bed up, the ball in there moves to give you a good idea what your exact height and angle is. So our bed alarm right up here, very important, especially if we take it off, we need to put it back on. So in order to turn it on, you're going to hold the green key and you're going to set it and you'll hear a confirmation solid note. Then if a patient is actually actively getting up out of bed, you're going to hear an alarm just like that. And then once the patient gets back into bed, you're just going to reactivate it. So whatever that may be. This one's the patient, once they get out of a supine position, once they start rolling around, the bed will activate. This is the most sensitive. This is the second most sensitive. This is a patient moving to the edge of the bed. And this one is a patient getting out of bed. Up here in our main panel right here, we have all sorts of different options. We have height of the bed, down and up. This part adjusts the knee area to bend it up or bring it straight, which can be locked with total knee replacement patients. This is the head up and down. This one's to contact the nurse. There's also different areas on the bed and also on the call light where you can call the nurse as well. This is a Trendelenburg position. This is a position that gets the patient head up, kind of brings them more into a position where gravity is kind of pulling the blood more down towards their feet. Flattens the bed. This is a bed and chair position. So when you activate this button, you need to activate the green key button here, as well as for any of these down here. Whether you lock or activate any of these, this green key needs to be activated. So when you're putting them up in the bed and chair position, just going to push that button. Head of the bed's going to come up, bottom of the bed's going to drop. And just hold it until it's completely in position. So the head of the bed may finish, but the bottom of the bed's still going to go. And this puts a patient in a good position where if they're not able to get up and down to a chair, they're able to at least have their body start resisting gravity to start improving their blood pressure, their oxygenation, their tolerance to activity, their balance, all sorts of things that can really help a patient with their outcomes and improving their ability to whether it's go home or do better with rehab. In order to flatten that out, we're going to make sure that green key is activated, and we're going to hit the flat button there. It's going to bring the head of the bed down and bring the feet up. Okay, other options on this bed, we can extend the end of the bed or shorten the end of the bed, making sure that our green key is active. This one shortens the end of the bed, this one lengthens the end of the bed. So it brings it closer this way. Or extends it out. Other options here on the main panel include locking ability for the knee part, or knee, let's see, there we go. So green key, and you activate or deactivate whichever aspect you'd like to modify. This one modifies the height of the bed, so right here, we're stuck with this height of the bed. And these, if you activate them both, don't allow you to modify the height or position of the knee area. So this button right here, if you activate with the green indicator and make sure it's lit up as well, locks both flexion and extension for the knee. Which is important when you're positioning the CPM, because if this part's bent up, our CPM is not in the proper position. And that's it for your standard hospital bed.